Hey guys, Dr. Brown from Brown Plastic Surgery. I have a great topic I want to talk about today, and that's capsular contracture. I wanted to describe to you what is capsular contracture, try to give you an idea of how it happens, and then what we do to treat it. So, anytime you place a foreign body into the body, you're going to form something called a capsule. So today I'm going to speak specifically about breast. So when I place this breast implant beneath the pectoralis major muscle, your body's reaction to this is a foreign body. It's not supposed to be here. So it tries to protect the body by forming what's called a capsule. So think of an amniotic sac around a baby. You form a soft tissue layer around the implant that is soft and pliable. So what is capsular contracture and what can happen to that capsule over time? So what capsular contracture is once you've got this nice soft capsule that's formed around the implant, over time, that capsule can start to kind of squeeze around the implant and cause the breast to not only look different, but to feel very firm. There are different classifications of the severity of capsular contracture, from Baker 1 up to Baker 4. And so 4 being a cold, hard, really painful breast, down to 1 being a palpable capsule, which isn't that bad. Usually the patients that we're seeing have a Baker capsule 2 or 3. That's normally what we see. And so in those situations, when a patient comes in, I'm going to talk about the treatment, but before I do that, let's talk about what are the theories of why this happens, because to be honest with you, we really don't know why it happens. We have a couple of theories that we think cause capsular contracture. The first theory is that bleeding in the pocket. So if someone gets a postoperative bleed, a hematoma in the breast pocket, those are considerably increased at risk for developing a capsular contracture because blood can be really irritating to the skin. So one of our theories is blood loss or a postoperative hematoma can cause a capsular contracture. The second theory, which is probably the most prevailing theory, is called the Biofilm Theory. And I sat in on a toxicologist giving a talk at one of our major implant companies' factory tour that I took one day that was talking about the Biofilm Theory and how that relates to capsular contracture. So here's what the Biofilm Theory states, that somehow we get what's called a slime layer around the implants. Not a slime layer that you can touch or feel, but under the microscope that they can see a film around the implant. And so potentially what they think happens is bacteria impregnate themselves and attach to that biofilm, and they're attached to the capsule. Now, it's not enough to cause an infection in the breast, but what the theory that these toxicologists say they think happens is that the bacteria send a signal to the overlying capsule, which causes it to start to contract. And so that's why when I start to talk about treatments in a minute, I'll tell you what's really important when we treat capsular contracture. So that's the theory of why it happens. So how do we treat it? Pretty straightforward. When someone has a capsular contracture, we have to go in and remove the entire capsule with the implant. And the reason that they both have to go is because if you do believe in the biofilm theory, then that means the bacteria has contaminated the implant, and if you keep the same implant, you're prone to getting another contracture. So the treatment is to remove the entire capsule with the implant, wash out the pocket with an antibiotic solution and betadine, and then we place a new implant if the patient so desires. So they are always at risk for having another capsular contracture in that breast because they've already had one. I can't really tell you an exact percentage of chance of getting one because it's all over the place in the medical literature. I've seen it as low as 8 to 10% and as high as 30%. So it really just depends on the study, how well it was done, but we're not really sure. One thing we do know is that most contractures, greater than 90%, occur within the first year after having a breast augmentation. So that's loosely what is a contracture, how do we think it happens, and how do we treat it. I want to talk about one other thing. So what are the things that we do in the operating room to try and prevent this biofilm from occurring and the capsular contracture from forming? Well, there's a couple of things that we do. Number one, in the past 10 to 12 years or so that we've had this, we have the Keller funnel. So Dr. Keller invented this bag which looks like an icing pipette bag for a cake. And what we do is during surgery, we will, number one, when we're ready to place the implant, use what's called a no-touch technique. We will change our gloves to fresh gloves. Only the surgeon will take the implant out of the package, which hasn't been touched by anyone else. We'll peel back the package. We put antibiotic solution and betadine because betadine will kill bacteria. We put that into the bowl. We swish that around without touching it. And in a no-touch technique, we will pour that implant into the Keller funnel itself, having never touched a human hand. We'll then use the funnel and we use a retractor to open up the pocket, place the tip of the funnel inside the pocket and then squeeze the implant into the pocket. The reason that that's important is this becomes a barrier between the patient's skin and the implant. We're trying to prevent the implant from touching the skin because despite sterilizing the skin during surgery, there's bacteria in the air and it can still land on the patient's body. We can't prevent bacteria from being in the room. So the idea with the funnel, not only is it a no-touch technique from our hand and the implant, but it's also to protect the implant from touching the skin. And then when we go to close, we make sure we don't touch the implant with our hand at all. So that's called the no-touch technique. And the theory is that minimizing bacterial contamination will minimize the biofilm, which will then minimize capsular contracture rates. So I hope that shed some good light on a tough topic for you guys. Thanks for joining me today. And if you enjoy more of this, watch my next YouTube video. Have a great day, guys.